Hi everyone, Michelle Fixit here. Today I'm going to be dyeing my hair while talking about POTS versus a CSF leak and any types of random bits of information that I can come up with while doing my hair, because I told myself that when I have to do my mandatory beautification that I will do some videos with you guys and try to educate, because I do a lot of how-to videos. Those are pretty easy. I just take a couple minutes out of my day to explain how to process, post it, and then that's just what happens. And then I even started like watch me work stuff where, you know, if I'm doing something more than once, then you guys can just watch me do it and you're not really adding any time, and I kind of ignore you guys. I'm saying it's an ASMR thing. I don't know. I'm just kind of making this all up as I go along. But anyways, today's discussion first is going to be that my hair is very knotted up because we went to the zoo today. And it was a hot day, and so I sweat a fair amount. And so I've been trying to recalibrate my salt levels, partially in vain, most of the day. Because if you have POTS or a CSF leak, then those two things are kind of, you know, they get messed up. So I have two phones hanging out right here, and I'm going to kind of blow your mind just right out the gate with the differences or similarities. I know, I haven't dyed my hair in a long time, don't judge me. I've had gray hair since I was like 18. You leave me alone. So the similarities between POTS and CSF leaks. So CSF leaks feel worse when they're upright. Headache is prominent. Nausea and vomiting is prominent. Lightheadedness and dizziness. Brain fog. Fatigue. Treatments can be effective because you get blood patches. Targeted blood patches, blind blood patches, venous fistula repairs, Pavlov cyst repairs, things like that. POTS feels worse when upright, same as CSF leak. Headache is prominent, same as CSF leak. Nausea and vomiting, same as a CSF leak. Lightheadedness, dizziness, same as a CSF leak. Brain fog, same as a CSF leak. Fatigue, same as a CSF leak. Mysterious, we don't really know the causation, correlation, whatever. And then treatment is learning to cope. So right out the gate, let's fix that, because that looks terrible. Get my hair dyed together. So I am trying to make as many videos as I can about this stuff because I'm kind of grumpy. I'm not kind of grumpy. I'm ridiculously grumpy. Let's clear the ice. Clear the ice. I've been upright too long, and I've been dealing with salt levels and mess ups and everything else. I am exceptionally grumpy, agitated, angry, bitter, mad that I have been robbed of many years of being able to treat instead of cope with my POTS symptoms that happen to be a CSF leak. Because I've been dealing with POTS-like symptoms, whatever you want to say, for years and years and years and years. I also have orthostatic hypotension, and so my body's just always out of whack. Dysautonomia, heavily suspect I have MCAS, lots and lots of things. Recently found out I have Chiari malformation, probably from an untreated CSF leak for years and years and years. Probably an acquired Chiari malformation. Confirmed CSF leak from a lumbar puncture when they were trying to figure out my chronic migraines that I've had for years and years and years. And it's basically like, hey, we don't know what to do, but you know, learn to cope with these ailments. We know that your body's all messed up, but you know, whatevs. So by accident, research, whatever, came across the CSF leak stuff, and I am now on blood patch number 2. First one was targeted because they gave me a CT myelogram on my right side and gave me a leak subsequently from that CT myelogram. So that was super fun because I had worked myself up to like partially, I believe I have multiple small leaks from having children, maybe from some spontaneous ones from car accidents as well. But basically, when they did the CT myelogram, they made everything way worse. It was like POTS on steroids. And it just really confirmed that I've been battling with CSF leaks for years because I had a new one and it was bad. Okay, I put part A and B. Now I shake. Multitasking. Life as a mom. So they did the targeted blood patch. That corrected things. If you're new here and you have no idea what I'm talking about, because I'm going to label this video as something to do with POTS. Hopefully I catch some fellow POTSies out there and then they get to go on their own little CSF leak adventure. Basically, you've probably been gaslit. You probably were gaslit trying to get to the POTS diagnosis if you were dealing with that prior to COVID. Since COVID, there have been a lot of new POTS cases. I heavily suspect, I know it looks atrocious, leave me alone. I heavily suspect that a lot of people after the COVID, like the COVID POTSies, it's probably that they just spontaneously started new CSF leaks. I'm not a doctor. I'm just Michelle Fixit from YouTube land. And, you know, if people can try to, like, peddle all these weird things, then, you know, if you want to judge me and say that I'm a cuckoo bird, I really don't care. I'm just trying to spread knowledge at this point because there are some very interesting, far-fetched things that people are trying to peddle each other right now out there on the land of the internet. So essentially, you know, if you suspect that you have POTS right now and you haven't had a tilt table test, and you kind of don't know a starting point, use these little smartphones. Like, this is going to be like a step-by-step criteria, I guess. That's how I'm going to start this off. So if you feel dizzy, lightheaded, you feel like you're having moments of tachycardia, you've noticed a correlation that it's whenever you're upright, so postural, and you're in the beginning stages of this, and you're just like, I don't know what's going on with my body. You need to talk to your doctor. Most people are not in an area, I say most people, a lot of people are not in an area where they have access to fancy smancy doctors that know all the different stuff. And it's really hard to get, even when you do have the fancy smancy doctors, if you're in a larger populated area. It's still really hard and it takes a long time. And, you know, doctors want to treat everyone similarly. We want to act like we don't have complexities. And we don't have, you know, rare conditions. And speaking of someone that has a multitude of rare conditions, quote unquote, and then I've had those rare conditions for quite some time, and as time goes on, some of my rare conditions are no longer rare. They're considered common. So it just depends on your area. It depends on your doctor. So if you are out here looking around and you're noticing that, you know, heart palpitations, headaches, dizziness, you might have some blood pooling, there's a whole host of issues, brain fog, chronic fatigue, you name it. For me, I also get like flashers and floaters, tinnitus, always really bad at like trying to multitask and pronounce things the right way and then worrying that somebody out here is going to like poke my videos or whatever. I read, just right off the bat, I read way more than I listen to things. And then my brain, because it's working at a deficit because of these random issues, like, you know, not having enough, somebody called it brain fluid, cerebral spinal fluid. And, you know, the bottom portion of my brain, my cerebellar tonsil is trying to escape, you know, just different stuff like that. But essentially, if you're in the very beginning parts of this and you're trying to find a cure, have fun. If you're trying to just have a doctor, like, I don't know, treat you because that's supposed to be part of their job, is treating medical conditions, you're going to want to try to get a tilt table test done. That for POTS, like if you're starting off with this with the POTS stuff. Tilt table tests take a very, very long time to get scheduled. They are super not fun. I had to wait almost a year for my appointment. I am now part of a POTS clinic as well because I am in a highly populated area, so I've been able to have access to fancy physicians and stuff like that, and the specialists of all the weird things. Been making my way through that, but it takes a very long time to get there. This is not an overnight thing. This is a very much advocate for yourself thing. So if you can convince a doctor to take you seriously and get a tilt table test done, then you will end up with a diagnosis for POTS, or not. And then you may, or not, end up with additional diagnoses, like I did. I ended up with a diagnosis for dysautonomia, which I knew I had, orthostatic hypotension, neurally mediated hypotension, and of course POTS. And so with that information, I was able to get into the POTS clinic. My cardiologist believed me, listened to me, everything else straight out the gate. As soon as I met her, I was like, hey, POTS, blah, blah, blah. She's like, all right, let's get this ball rolling. Not a POTS doctor. I'm going to try to help you as much as I can. There was a huge misconception during that time period, also with my neurologist because of my chronic migraines. And so both of them were really advocating for me to get rid of caffeine because that was going to be making my migraines worse, and that was going to be making my POTS symptoms worse. I tried to do all that, and it actually made me substantially worse. I could not get upright time. And at this point, I didn't know that I had a CSF leak. I had not done anything about that. All I knew is that my body did not work well with that. I literally couldn't get upright. Every time that I would lay flat, I was not great. I was way worse. It was like my first little bit of time being upright with normal conditions, which was just not great. And then whenever I would sit up, POTS symptoms immediately, headache immediately, nausea, all these things immediately, like POTS on a terrible day. So my husband, after seeing me suffer for several days after that, he's like, you just need to do whatever you need to do to get yourself squared up. Turns out that once I finally got into the POTS clinic, first day talking to a POTS doctor about that, she said some patients do well with caffeine when they have POTS and some don't. So I'm here to let you know that a POTS doctor from a POTS clinic at a major hospital, and if you ask, I will tell where I've been, who I've seen, all that good stuff, basically was like, yeah, your caffeine is, helping you. Some people it helps, some people it doesn't. But if you're in the beginning stage of this, you need that tilt table test done. Well, it'll make things a lot better. You can do a poor man's tilt table test. You can Google that and essentially use your fancy phone. That's what I was trying to get to before I got distracted by other randomness. Use your fancy phone and record yourself doing that. So look up the poor man's tilt table test if you can't get your doctor to take you seriously or do it in office or whatever, and get yourself a blood pressure cuff and have yourself at rest for 20 minutes to half an hour. Record it. They can fast forward. They can see you laying down. Not a big deal. Have that cuff on you. Take your blood pressure a couple times. Document it. It'll be on record. It'll be on the recording anyway. So flip the phone over to your blood pressure cuff and say, hey, this is what blood pressure is right now. It would be better if you had somebody doing this for you, like recorded you and then recorded the blood pressure cuff readings. And then you sit up or you stand up, because if you were doing the tilt table test, then it would stand you up. And then you do a read. And if there's a 30-point adjustment between you laying down and you sitting or standing up, that's one of the criteria for POTS. Easy peasy lemon squeezy. If you really want to kind of blow their minds, stand there for a little bit longer and do some more readings. It's just what you do. And then you take that into the office and you say, look, this is abnormal. And, print out the criteria for POTS. Tell them you want to see a cardiologist. If you're at a cardiologist and they still don't believe you, make them watch that stuff. And if they refuse to get you in schedule you for a tilt table test, tell them that you want it in writing that they're not doing that. Say, you don't think that I meet the criteria for doing the tilt table test, or you're trying to say that I don't need a tilt table test or whatever. I want you to put that in writing. I want you to write up, document, give me something with your name, your information, stating that you don't feel like getting that test to get that diagnosis is relevant to a condition that I'm telling you, showing you, and proving to you I meet the criteria for. And that's how you start playing with, you know, the big pew-pews on this. It's like, you know what? I didn't know. I didn't know. I advocated for myself, not hard. Now I look really ridiculous. I advocated for myself, not hard, pretty decently, for a long, long time. Over 10 years, over 15 years, about 18 years. But I was complaining about some of this stuff earlier than that, and so that's a whole different story. So you want to kind of play hardball with your doctors. They're not your friends. They're your doctors. They're there to treat you. That is literally what they went to school for. That is what they're supposed to be doing. We're at a point where, because I do have so many conversations with doctors, unfortunately, patients get grumpy with doctors and say that doctors are the gatekeepers of medical care. Doctors say that insurance companies are the gatekeepers of medical care. Everyone wants to point fingers to everybody else. And we are at a point where patient care is being treated like herded care, where, you know, you need to see X amount of patients in X amount of time because insurance is only going to pay this. And so we need to book them in as fast as we can, spend as little amount of time as we can, overly document, realize that we're going to lose some money because the insurance company's job is to not pay out or not want to pay out. Doctors don't get paid additional for trying to say, hey, my patient, you know, let me write up a letter for an hour about how my patient really needs this test. It's in office, chief complaint, blah, 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 blah. That's what it is. So you have to learn to advocate for yourself. So if you are able to get your POTS diagnosis, if that's what you're if that's what your goal is. Oh, I forgot to get it back from right here. You know, poor man's tilt table test, real tilt table test, if you're trying to get the actual diagnosis because you feel that that's going to be helpful for your medical care, I'll do that. Then that's how you get it done. However, pause for effect, I really think that you should try to give me a second to set an alarm for this die. If you do meet the criteria for POTS, tilt table, no tilt table, whatever, definitely video regardless. I think that you should work on troubleshooting yourself at home in the midst of, you know, dealing with the doctors and all that other stuff, because you'll wait forever trying to get diagnosed with your doctors. So if after you've looked up the criteria and you have POTS, or you've been previously diagnosed with POTS and you really don't care about the rest of the stuff I was just talking about, then what you should do, because as I just read to you, POTS and CSF leak, same stuff, start troubleshooting yourself at home. So if you meet the criteria for POTS and stuff like that, one of the big things that you should try to do is look up the 48-hour flat test. That's something that I believe, and if I'm wrong, grump at me in the comments. This is all based off of memory. I am not Google and a human, okay? I am giving you information that I have previously overly researched, still working with a physical deficiency that creates issues with brain fog, memory issues, random bouts of tachycardia, and now bradycardia, which prior to having a heart monitor for a couple weeks, I didn't know that I had going on. And then, of course, the orthostatic hypotension, which also creates this whole host of issues. So, if POTS stuff is there, POTS symptoms are there, look at the 48-hour flat test, print out the 48-hour flat test, It's going to be a couple sheets, and you basically just lay down for 48 hours. And you take you write down your stuff before. There's one for the during. I have not done this yet because luckily I did not need to do this in order to start. I got really lucky with my treatment stuff. And so if you're not geographically able to immediately get seen, like how I was lucky, where I was able to find a specialist, then do your 48-hour flat test. Give that to your doctor. Document that as well. If you require referrals, get yourself in. If you have to go through a neurologist first, go to a neurologist first. A neurosurgeon would be better. Hopefully, if you Google the spinal CSF leak, there's a spinal CSF leak like foundation or something like that, and they have it listed where the CSF leak centers are. There were, based off the last time I looked at everything, there were 15 in the country, which is sad, because I would be willing to bet money at this point that in the next coming years, whether it's 5, 10, 15, 20 years from now, we're going to find out that we have a lot of leaky people. That's my belief. So it's kind of sad. I don't know how many POTS clinics there are, but I would garner there's more than 15 in the country. So see if you are geographically in close proximity to a CSF leak center. If you are, take your 48-hour flat test in there. If you have your POTS diagnosis, take that in there. If you don't, take your poor man's tilt table test video in there. Advocate for yourself to get yourself in front of a CSF leak specialist with as much information, trying to let them know that you have either POTS or CSF leak symptoms. Because POTS is deal with it, cope, sorry, chronically ill, boo-hoo, sorry. CSF leak is frustrating. A lot of the people that will go in, your first step, if you can get into a neurosurgeon, or like I think Ian Carroll's like an anesthesiologist or something. But what your first step should be, or anyone that you can get a hold of. How about that? Let's just loosely say neurologist, neurosurgeon, whoever you can get that deals with the brain as their specialty. You want an MRI, MRA with a burn score. And that will give you a score that will let you know the likelihood of you having a CSF leak based off of the vasculature in your brain and the cerebral spinal fluid that comes back with the images. And that will give you your first concrete, and if you get a low score and it's like, some people get low scores. So as a preparatory thing, if you were able to get someone to order an MRI, MRA, burn score, radiological image done of your brain, and I think mine was like my brain and my spine, then go in there, try to schedule it late in the day and have it where you've been upright as long as possible. Like, I will get to a point, and I'm diagnosed, I have blood pressure pills and all this other stuff to try to increase it, I have coping mechanisms. I used to get, before I knew what was going on, I used to get to a point where I was like, I'm not safe to drive. Like, I just knew that. Like, how I don't understand how people, drink and drive. I don't understand how they don't recognize that they're not safe to drive. My symptoms, on occasion, because I didn't know what was causing them, I didn't know the correlation, I just knew that, sometimes they happened and sometimes they didn't, and I was just at the mercy of whatever my body decided to throw at me that day, or that hour, or that second. There were time periods where I'm like, I'm not safe to drive, I'm not driving, period. I wasn't under the influence of any substances, I wasn't under the influence of alcoholic beverages, because I rarely drink, because it doesn't do well for my body. Because it's a vasodilator, which just makes everything get way worse. And I would get to points where I was not safe to drive. So now I know that that's because I had too much upright time and not enough time to build an appropriate amount of cerebral spinal fluid pressure within my body and my brain. And then I also have CCI, which is cranial cervical instability or cervical cranial instability. I don't know. It flip-flops in my brain. Whatever. I gave you the information. Look it up. It's basically when your posture in your head and you have too much flex and like all this stuff. And I have a lot of coping mechanisms that are making my life substantially better, and I am super excited with the progress that I've been making instead of being at the mercy of my body. So, get yourself as bad as you can get with being upright as long as you can be before you go in for that MRI, MRA, burn score thing. Because I asked my neurosurgeon when he said, we're going to get this test done. I was like, fantastic. I'm super excited. Like, I really didn't think it was going to be this easy. Like, because I had to fight really hard for years. And it's like, I saw the cardiologist and I was like, hey, I almost died of COVID. I had all these things happen with my heart. I have all these other pre-existing conditions. Please believe me. And I expected her not to believe me. Like the other people were just like, whatever, who cares? And she believed me. And then she put me in front of the test and I was just like, where were you years and years ago? So like when you have the right doctors in the right places, they literally change lives. And we're not talking like, someone's on the verge of a heart attack and you have a, just barely graduated med school cardiologist and like they save their life. Yes, that's fantastic. I'm not taking away from that. But that's like a common issue. If you have clogged arteries, then you are at risk of having a heart attack or a stroke or a cardiovascular event or something. But like when you have these like things and then you have doctors that just really don't care, or they think that you're just a hypochondriac or whatever, which is one of the things that women get a lot, which is incredibly frustrating because maybe we have to use our big girl voices and get grumpy and overly talk about our issues because nobody believes us and listens to us. And maybe, just maybe, we would like to be functional people because we see other people being functional people and our mentality and our bodies are not cooperating and we're just being called like melodramatic. And it's just like, she just has so many issues. She just loves to complain about stuff. It's a whole different thing. Or maybe you pulled yourself together enough to be able to like, I don't know, not be bedridden. And so they're like, no, you're functional, you're fine. No, functional and fine are not the same thing at all. Because if I am barely scooting through life with what I have going on right now, and I'm working at a serious physical deficit because my body is going haywire all the time, imagine how much better I would be if my body actually worked almost properly, or even properly. Like, let's shoot for the gold. So, if you get the right doctor, this is all easier. I had the right cardiologist, told her about the POTS, guess what? Easier. I went in to the CSF leak doctor, and he's a neurosurgeon, and he's a professor, and he's awesome. He has great bedside manner. He's a fantastic guy. And even if he had crappy bedside manner, I wouldn't have cared because he's written papers with all the big fancy guys that only specialize in this stuff. So I was like, I really thought that he was going to just blow me off. And he was like, nope, we're going to do this, and we're going to do this, and we're going to do this, and here we go. And I was like, where have you been my whole life? Like, I fell in love with this man. I fell in love with the woman that diagnosed me with POTS, or got the test done, got the test, the referrals, and then she was trying, and she was awesome. Come on, you get the right doctor. Life-changing. Anyways, so you get your MRI, MRA, burn score, pause. Oof. Because I forgot my eyebrows. They look really bad. So you get those done, and then what you're going to be doing is, if you have a good doctor, like I had a fantastic doctor, because I'm not done with this adventure yet. If you have a great doctor, or a decent doctor, or it's just not a pooper, they're going to let you know what happened with your CSF, or your MRI, MRA, burn score. And then what they should do is they should say, you know what, we can try some blood patches, or we can try to find out where your leaks are coming from. So for me, I was very nervous about the CT myelogram because I knew that with them putting contrast and stuff into my, this is Just for Men Easy Combin color, It's meant for guys with their beards. I use it for my eyebrows. It's fantastic. Guy products sometimes are way better than girl products, as a random segue. So this one, it stops working in 10 minutes. This is not going to stop working in 10 minutes, but this is. And so then I can like wash it out whenever I feel like it. Just as like a random thing, like if your eyebrows are getting lighter. So he was like, he's like, we can do the CT myelogram because if we can find out where your leak or leaks are, then we have a 96% success rate for correction. But I was really scared about getting a new leak from that, which is what ended up happening. I do have grumbies because I really wish that, like, I think my doctors are fantastic, but I fully recognize that this is not the only thing that they do. This is not their only specialty. Because if you can, there are super awesome, I don't know, I haven't met them, but the information they put out, like, they're the leaders in the CSF POTS thing, or just the CSF leak thing, spinal CSF, all that stuff. But you still need to find a cranial CSF leak doctor, because I'm pretty sure I still have like a small cranial leak right here, but I feel like it's almost squared up, but I don't know. That's a whole different thing, and I'm not chasing that adventure yet right now. And yes, that was kind of redundant. But anyways, so it was like, we can do the CT myelogram and try to find out where your leaks are. And I didn't realize it when we were talking, but evidently there are 2 CT myelograms that you have to do. You do one for your right side, one for your left side. The place that I'm going to, and again, you ask, I'll tell. It's not a big deal. I will not be a gatekeeper. There's some other creators out there that are talking about this. They're like, I don't want you to know who I have because, like, I'm still doing treatments and blah, 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 blah. And it's like, look, do you live at the doctor's office? You don't. So if one of your people that watches your channel happens to see you in real life, they may or may not recognize you. Help the peoples. Your doctor is clearly helping you, so you help them. Just saying. Anyways, so CT myelogram, and I didn't know at the time, but it was like a right side and then a left side, and I didn't know that. I thought it was going to be one and done, and I was still nervous about it. Well, as it turns out, when I did go ahead and get it scheduled because, he made a big deal about it. My dad ended up coming in town. He's not normally geographically available for offsetting stuff. He still works, and then he lives about, I think, like 1,300 miles away from me. Wow, this eyebrow looks way different than this one. But he was available because I was making him go to doctor appointments and stuff too. And so my husband, Kat, was able to get me to the doctor. Unfortunately, I did get a leak. Unfortunately, I was bedbound for 5 days because of, I think, a serious issue that they need to correct at their facility, which is you patch somebody on a Thursday, you tell them that, 24 or 48 hours, 24-hour mark is a Friday, you are closed, like, in the evening, because I waited the 48 hours because I'm stubborn like that. And then called, couldn't get anyone to patch me. It was a big deal. And then when I finally got a hold of somebody, they're like, we don't patch on the weekend. You have to wait until Monday. So I was bedbound for like 5 days. It was not fun. It was horrible. And it wasn't actually 5 days. I don't know. Got it Thursday, was messed up. Thursday, Friday, Saturday, Sunday, Monday. 5 days, sort of. So, the people that only do the CT myelograms typically have a protocol where after they get done with the CT myelograms, like, they're fancy pants. According to another creator, she was able to get her right side done, and then she had her left side done the next day, and then they blood patched her after. I would have got both of my CT myelograms done if that was, like, the case for me. I would have totally done that. But it wasn't offered. So after the whole leaking thing, that's when I found out that it's a CT myelogram for the right side and that the left side is a different one. And so I will be waiting until my dad comes back again and then making sure that I have appropriate things in place in order to get the left side. Because I do have 2 suspicious things for venous fistulas. but they don't want to do any corrective measures with the ones that are on my right side until they have a complete image on the left side, because if I have like a big regular leak on my left side, then they'd rather like treat that. So I had the CT myelogram blood patch done the Monday following the Thursday new leak part, and then I had a blood patch and then I had a blood patch, which I'm a few days off of right now, and I'm substantially improved. But it's weird because like I get it done, like with both of them. I had both of them done, and I was so good, like not what I feel like 100% should feel like, but like so ridiculously improved that I'm angry that it took me this long to get here. But then, like, as time goes by, I feel like a little bit less, a little bit less, a little bit less. And so that part's kind of frustrating. So I don't know if it's that those two things that they suspect to be that are suspicious. Like, the people in California, they specify with the language that's used in my reports. I can't remember. It's on my chart. I don't know. That they typically are indicative of venous fistulas, because they didn't even know about venous fistulas until, I don't know, 5-10 years ago. They weren't even really working on this kind of stuff like till 15-20 years ago, which sounds like a really long amount of time, but the medical field just like moves so progressively slow, which is just like ridiculous, much like how I look right now. So I'm doing better with the blood patches, which makes me happy, but I'm also just kind of frustrated because as time goes by, I just feel a little bit less, and I'd like to stay where I was like right after the blood patches. Not the pain from the pokies, but the alleviating of symptoms and stuff. I got a whole day where my blood pressure was like almost normal without Midodrone. It was fantastic. My tachycardia was still kind of weird, and I didn't feel like I experienced any of the bradycardia periods, which was nice. So I'm dealing with the doctors that I have available to me. So I still need to get the left side CT myelogram done. If you want to pull the trigger on getting a CT myelogram done, which is recommended because blind blood patches, you need numerous ones. You're just kind of shooting in the dark and hoping for the best. It would be good to get the CT myelograms done and just know ahead of time. You have to go in for your right side, you have to go in for your left side. If anesthesia is available, light sedation, get it. Seriously, get it. Because it was not fun with the anesthesia. And I don't want to know what it would be like without the anesthesia. Blood patches too. Get the anesthesia for the blood patches, seriously. And try to argue to get a proactive blood patch. Don't be flat on your back for 5 days like I was. It's just not fair. And honestly, that's a big complaint that I have. The other complaint that I have is that there's another creator that is talking about her CSF leak venture, and I feel like I know who she's getting to see, and I just don't have that time available to go where I think she's going. But she had a high volume multi-area blood patch done, and I am envious of that because my blood patch that I had done was 20 units for the CT myelogram and 20 units, like the corrective leak, and then 20 units for the blind blood patch, which I think that and I have to talk to her because I think she was aiming in the area of the suspected venous fistula thing, like the lower one. But I'm going to talk to her about the possibility of getting multiple areas done in a high volume, because the other creator had 10 units in one area, 15 units in another area, 15 units in another area, so that's 40 units of blood, and I had half that, and I only had it in one area. And I'm at the point where it's like, clearly this is working, because even though I'm grumpy that like I feel so good after the blood patches and then I slowly lose a little bit of it, I'm still so good in comparison to where my baseline would be. Because if I was just a POTS patient right now, And I did. I talked to my POTS doctor about it because it takes like forever to get your appointments and stuff. And like you just talk to them like they're friends, but then they know all your weird stuff because they're literally doctors of all your weird stuff. And you're like, I'm not alone. And now there's a person that specializes in the weird people like me. So that part was like really fun. And I was like, yeah, I think I have a CSF leak, and I'm trying to do the whole venture, blah 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 blah. And she's like, yeah, we have some other patients, and they've gone down that route, and blah 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 blah, and like, you know, I don't want you to get your hopes up, and blah, 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 blah. And it's like, there's literally a doctor in California that's like trolling the POTS clinic at Stanford. And like, he's stealing their patients because they have such a long wait list. And like, as soon as they get the patients, and then it's like, you have POTS, you have headaches, come over here. Come over here. We got something for you. We might be able to fix you. And he's fixing them. He is fixing them. POTS people with headaches come to him from the POTS clinic, and he fixes them. That sounds a lot better than, here, take some Metadrone, which has a bunch of weird symptoms. I even have a low dose of it because they wanted to give me a higher dose because my blood pressure was like really low, and I was like, I really don't like medicines. And so can we do a really low one? And even with that really low one, when I take it, I swear it mimics intracranial hypertension. Because, like, I feel like when it's all said and done, if I ever get a hold of, like, the fanciful doctors, that I'm a high-pressure leaker. I think that's what it is, which is a whole different thing, and you should look it up and everything else. Because there's, like, different categories of this stuff, and if you're a high-pressure person, like with your fluids, your cerebral spinal fluid, you're more likely to have spontaneous leaks. If you have EDS, you're more likely to have spontaneous leaks, connective tissue disorders, blah, 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 blah. So, basically, if you've come across my random video and you're a POTSy or an EDSer and you are plagued with just not feeling good, because maybe you don't even know about the POTS stuff. Maybe you're just like, man, I got some headaches and I got some lightheadedness and some dizziness, and like everybody says it must have something to do with EDS stuff. Or like maybe you're just flexible or bendy or whatever, and your body doesn't work properly and you haven't even got to the EDS thing because you're like, I didn't know people could do this crap. I didn't even know I could do this until a doctor asked me if I could do it. Because they're like, your arms, you can't really tell that way. You can't tell that way either, but it's there. Some way you're going to be able to, I think it's the road that's throwing it off. Like, you see how it's like up in, yeah, weird arms. And so, I don't know. I can't even remember which doctor first brought that to my attention. I think it was my ortho, like, disease 11. I think it was my ortho like 10 years ago. Because I went in for something totally unrelated, and she was like, maybe Picatus, yeah. She's like, can you like bend? And she started trying to show me, and of course she couldn't do it. And then she pulled the picture up. She's like, can you do this? And I was like, no, I can't do that. She was like, well, just try. So I was like, I can do that. Why can I do that? And then the other ones are like the fingers. Can't really see, but this one, because I had surgery, I can't do it anymore. But I used to be able to do all of them, and it's weird because this surgery has impacted these three, but I can still do my pinky. Like this one. Again, you're supposed to have like a flat surface and do it, but I mean you can see just like having my hands, they all like fan out weirdly, and that's just their natural weirdness. That's abnormal. That's abnormal because I think normal people are like maybe there, but like I can fan them up pretty far. And there's other stuff like with the legs and the knees, and I don't know. But hopefully this random video sort of helped you. I don't know. I always start these videos thinking I'm going to be like a little bit more organized, and then I end up looking like a cuckoo bird in some way, shape, or form. But you guys like and subscribe. Have a fantastic day. I will see you next time. And good luck with your medical adventures. Bye.